Hi, I'm Dr. Clay Morton at Morton Chiropractic Clinic. Today I'm going to talk to you about a condition called uppercross syndrome that creates all sorts of pain and suffering in our patients. When we have rounded shoulders, because everything we do in life is in front of us, driving, working, paying bills, checking your phone, this starts to round our shoulders forward because we have tight chest muscles. When that happens, it's going to bring your head in front of your shoulder, and now it's also going to drop your head to look down at the floor. We don't look at the floor, so then the head naturally rises, but all that extension happens right at the base of the skull, which creates a tight suboccipital muscle, which can cause headaches, neck pain, all sorts of tightness and conditions. With the head being forward, it has a lot more demand on the side neck muscles that hold up and stabilize your neck. So it creates a host of different problems. So we will need to tighten, strengthen the weakened muscles and stretch the tight ones. We start by stretching the front of the chest muscles, the pec muscles, because they are the tightest and gives us the best relief of condition fastest. You can do it a couple ways. You can grab your wrists, straighten your elbows, and just pull your shoulders back. You can do it in a corner of your house. You're going to put one hand on either side, pointed toward the wall, the same distance, and then you're going to step into the corner and it will pull this back. You hold it for 10, 20 seconds, you step back, relax, and you repeat. When you step in, we don't want you to lead with your head, because this is actually what we're trying to correct. You lead with your hips. You can do it in a doorway. Forearms go on the door frame, biceps parallel, and we're going to step in, hold, step back. 3 different ways to stretch this muscle. The side neck muscles that need to be stretched are the upper trap muscle and levator scapulae. We're going to turn our head to the left, 45 degrees, and then take your nose down to the left hip without tilting your body. You're going to hold for 15, 20 seconds and then come up. A way to accentuate this and the next stretch is, as you do this part, you're going to take your opposite hand and pull down your leg. That will accentuate and you'll feel a stretch in here. So we're stretching both sides of that muscle. The next one we can do is we're going to turn our head back to 45, but this time we're going to take our opposite ear and go forward to the other hip. And then you're also going to pull down. So this stretch stretches this muscle on the left side of my body. So we do nose to each hip, and then we do the opposite ear to each hip. The next one we want to stretch is this back occiput neck muscle that's continually tightened if your head's in this position. What we want to do is just not rotate, but keep your chin level and push your chin directly back, bringing your ear closer to your shoulder. So how we do this is you stand in front of a mirror in your bathroom, and you're going to keep your chin level, and as you push back, we don't want to see more of your chin throat or less of your chin. And when you do it, unfortunately, most people have a double chin when they do it. That's part of the way that you know you're doing it right? And it's going to stretch that muscle in the back. You can also do this laying on your bed, and you're going to push your head into the mattress. The last one we want to work on are these muscles in the back between your spine and the shoulder blades. What we want to do is you're going to pull them back together. So you're going to see those shoulder blades, scapula, come back together. We do that. You can do it just by holding, or you can have a bungee cord connected to something on the wall, and then you just pull them back first. Then you can bring your hands in. But we want to make sure that that move is the first move. Because if you don't, you can do this, think you're doing the exercise, and you're doing nothing. So pull that back first. You can also do it with a weight. Bend forward, brace yourself on some chair or ottoman, and then you're going to pull up to the ceiling and then bring the weight to your chest. Both of those work great for strengthening that. And that's how we get rid of this condition.